Peace and light, primary care providers. My name is Dr. Sonia Fulgham, and I am grateful that you made time to join me today. As we know in clinical practice, encountering medication induced gastrointestinal side effects and undesired outcomes is common. Whereas the adverse gastro effect of certain medications are well known, this is not the case with psychotropic medications. Even more scarce is the awareness about how prescribing psychotropic medication in patients with a gastrointestinal disorder can lead to an adverse outcome. So let's take a look at this and how this could happen. Although there are other gastrointestinal adverse effects, the most common ones are nausea and vomiting, diarrhea, and constipation. Notably, these effects occur regardless of pre-existing gastrointestinal disorder. As such, the use of antipsychotics on patients of gastrointestinal disorder could cause elevated or aggravated levels of these gastrointestinal adverse effects. In depth, coverage of each of these three gastrointestinal adverse effects follows in the next slides. Let's start by taking a look at nausea and vomiting as a gastrointestinal adverse reaction. First of all, it is important to note that nausea features as an early side effect with the use of numerous psychiatric medications, including mood stabilizers, SSRIs, cognitive enhancers, and psychostimulants. Here are some examples of drugs in various categories that have been shown to present with nausea as gastrointestinal adverse effects. Sedative hypnotics, analytics. Examples here include zeplicone and aziplicone and zolpidem and buspirone. Antidepressants, as you may already know, antidepressants include SSRIs, SNRIs, and novel action agents, and TCAS. However, SSRIs like citalopram, Sodus Alexa, Fluoxetine, Sodus Prozac, and sertraline, Sodus Zoloft, just to mention a few, well as SNRIs and novel action agents like duloxetine, sold as Cymbalta, and venlafaxine, sold as Effexor, XR, have been associated with nausea and vomiting as a GI adverse reaction, while this has not been the case with TCAs in general. Mood stabilizers. Almost all drugs in the category include the likes of lithium, lamivudine, carbamazepine, valproate, and oxycarbamines have nausea as gastrointestinal adverse effects. Cholinesterase inhibitors like donepezil, which trades as Aricept or Aricept ODT, and galastamine, which uses the trade Rimonel and now trades as Razidine, has also been associated with nausea and vomiting as a gastrointestinal adverse reaction. Examples of psychostimulants that have been associated with nausea and vomiting as a gastro-adverse reaction include atomoxetine and modafinil and otomodafil. In many cases, diarrhea manifests as an early sign of lithium toxicity. Paradoxically, Slow-release lithium formations are also a remedy for chronic diarrhea. Gastrointestinal adverse reactions have been linked to certain psychotropic drug categories. These include antidepressants that classifies as SSRIs in general, and specific drugs like paroxetine, which is sold as Paxil, and Cirox, or under other brand names. SSRI usage have been shown to cause diarrhea as a gastrointestinal adverse reaction. Although many mood stabilizers cause diarrhea as a gastrointestinal adverse reaction, not all of them have been associated with this. Examples of mood stabilizers have been linked to diarrhea as a gastrointestinal adverse reaction are carbamazepine, trading as carbazole, T-E-Geritol, T-E-Geritol XR, and Exportart, or Epital. Lamidodrine, sold as Lamidotol, and Valproate, whose trade names include Epilim, Depakote, and Convolex. The other categories of psychotropic drugs that have been associated with diarrhea as gastro-adverse reactions are cholesтерine and inhibitors. These include drugs such as donepezil, trade as Aricept or Aricept ODT, and glutamine, sold as Razidine presently. Constipation as a gastrointestinal adverse reaction has been traced to the use of some psychotropic drug categories, while others like sedative, hypnotics, or analytics are rarely implicated. The drug categories implicated in causing constipation as a gastrointestinal adverse reaction include some SSRIs like paroxetine, SNRIs, and novel action agents like venlafaxine, sold as Exavar, nafazanon, sold as Dutian, Cerazone as Nafardar, and other brand names, and Martapazine, which is sold under the brand name Rimron, as well as selected TCAs. Generally, most antipsychotics include atypical agents like clozapine, and low-potency typical agents cause diarrhea as gastrointestinal adverse reactions. Diarrhea as gastrointestinal adverse reactions can also be caused by memantine, which trades under such brand names as Namenda, Abixa, and Oxara, amongst others. Some psychostimulants, like atomoxetine, which is marketed and sold as Strattera in the U.S., has also been linked to causing diarrhea as a gastro-adverse reaction. It is important to note that not every reaction results from the use of psychotropic drugs. For example, constipation could also result from metabolic diseases like hypothyroidism or diabetes, diet, and non-psychotropic drugs, and neurological diseases. In the event that a gastrointestinal adverse reaction appears, some of the ways to deal with this include the following. Discontinuing the administration of the drug is usually the most immediate action, with gastrointestinal adverse reactions are noticed. This is especially useful during the early stages of the patient starting treatment with SSRIs. In some instances, changing the formulation of the drug results in a favorable outcome that reduce or even eliminate the gastrointestinal adverse reactions associated with the given drug. For instance, the use of lithium could cause nausea and or vomiting. However, changing its formulation from lithium to lithium citrate usually helps. For some drugs, like carbamazepine, for instance, spreading it throughout the day could help. You can also replace the drug that is associated with nausea and or vomiting. For instance, you can substitute sodium valproate with divoxapine sodium. While there are several considerations to make when prescribing any of the psychotropic drugs to patients diagnosed with gastrointestinal disorders, I would like you to keep in mind the following two considerations could go a long way in invading gastrointestinal adverse reactions. Firstly, extensive evidence has shown that SSRIs have some benefits for patients who have been diagnosed with constipation, predominantly irritable bowel syndrome. For example, fluoxetine has been reported to have an effective remedy in this regard. Thus, prescription of SSRIs to such patients is recommended, although this should not imply foregoing notable gastrointestinal adverse reactions and pre-existing conditions. Secondly, on the other hand, it is recommended that TCAs are administered to patients who have been diagnosed with irritable bowel syndrome, which is characterized by predominant diarrhea. This is because evidence shows that prevalent prescriptions of TCAs with registered effectiveness to IBS patients with abdominal spasms and diarrhea. So, in conclusion, the most common gastrointestinal adverse reaction that are likely to be caused by antipsychotic drugs in patients with gastrointestinal disorders are aggravated nausea and vomiting, diarrhea, and constipation. It is noteworthy that antipsychotic drugs fall under different categories. As such, various categories of antipsychotic drugs cause different gastrointestinal adverse reactions in patients without pre-existing gastrointestinal disorders. However, the adverse reaction levels are likely to be higher in patients with these disorders. In the event of gastrointestinal adverse reaction, you have the option of discontinuing the implicated drug and altering the formation of some drugs like lithium, dividing the dosages and spreading it across the day, or substituting the drug with another one that is not associated with gastrointestinal adverse reactions in question. I would like to now take the time to answer any questions that may have not been covered. Thank you, and have an amazing day on purpose. Peace and light.